Okay, now could you just move down? Go ahead and move down. Okay, move down a little more. There you go. Okay. Now just make yourself comfortable, relax. I'm gonna leave now. What's an orgasm like for you?
I'm gonna say that it's like a blooming flower. It comes from the roots and grows up until it spreads beautiful aroma around the room.
It's like coming down from the highest and the best roller coaster ride. I think it's different sound. It's definitely a different sound. It'd be like, ah, with the roller coaster, but with the orgasm it would be, oh. Is there something that comes to your mind when you think about having an orgasm?
War. That's what I think about, is the war in my head. I'd like to, I hope I do. What's wrong with me, I can't. And so by the time I get through having this conversation in my head, I am not involved anymore in the now and in the activity that's going on.
Why does it hurt you?
It's very frustrating. It's very, very frustrating to enjoy sex and to never get to have that release. I don't want to be hurt anymore about this.
In this morning's Healthy Woman, something new to deal with an astonishing statistic. 43% of women aged 18 to 59 have some kind of sexual dysfunction.
Female sexual dysfunction. Symptoms include lack of desire, lack of pleasure, painful intercourse.
This is a very new field of medicine, but there's a good chance the problem can be tackled.
The FDA has only approved Viagra for men, but some doctors, such as Jennifer Berman, believe Viagra might help women too. As many women hold their breath and wait for the cream or spray or pill that might work for them, the race is on to be first. The prize, undoubtedly, billions upon billions of dollars.
Vivus was a pharmaceutical company that was busy developing an orgasm cream for women.
Your name?
My name is Liz Canner.
Okay, just a moment.
I'm a documentary filmmaker, and Vivus contacted me because they needed some help with the clinical trial of their new drug.
Vivus is a company that develops drugs for male erectile dysfunction, and we're currently getting into the female sexual dysfunction arena. We're doing some early phase clinical trials. What we want people to do is they're going to have to come into a doctor's office and they're going to have to apply this drug, and then we're going to have to measure a sexual response. What we intend on using is visual sexual stimulation, which is visually explicit material. Well, we need some help with the actual production of the video.
Vivus wanted me to put together erotic video for use during the testing of their new drug. I thought, how could I take this job? How could I not take this job? I was curious about the latest scientific thinking about women and pleasure. So I gained permission to film Vivus for my own documentary. Little did I know that I would spend 9 years documenting the medical industry's attempt to change our understanding of the meaning of health, illness, desire, and that ultimate moment, orgasm.
Sex pill, I need those hormones, baby. Sex pill.
What's the name of the company mean? It's Latin for alive. And I just had the feeling that our objective was to put life back into dead penises.
Doctor of pleasure, doctor desire. Fill my prescription in life.
12 years ago today, I incorporated the company. And as you can see, it's a real joyous, boisterous crowd.
Vivus 12th anniversary, April 16th, celebrating 12 years of success.
Sex pill.
found Vivus?
After a radical prostatectomy for cancer, my privy organ was no longer alive. And that's when I focused on what could be done in the field of sexual dysfunction. All the drugs that we developed, all of them started on me.
In 1996, Vivus was one of the first companies to win FDA approval for a drug to treat erectile dysfunction. It was on the market 14 months before Viagra.
It was heady days though. I mean, you watch the stock price go up every day. Our market capitalization was over $1.5 billion.
But for only a few days.
Then Viagra was launched obviously 14 months later, and our sales of product actually started to deteriorate.
When Vivus was no longer the marketplace champion for men, they started testing their erection drug on women. This new treatment was called Alista. How does Alista work?
What happens when you add Alista, our product, with sexual stimulation? What effect does it have on cyclic AMP? In this case, it increases it pretty dramatically. That in turn decreases intracellular calcium, which in turn causes increased blood flow.
How will you know if a woman has been cured by Alista?
The end point in the male is rather straightforward. An erection occurs or it doesn't. Female doesn't have that same type of a vertical indicator. So we're dependent upon a diary or on questionnaires rather than doing a measurement of the amount of engorgement of the penis.
What about orgasm?
Well, interesting equation here that increased blood flow hasn't conclusively been shown to cause orgasm.
How many drug companies do you think there are out there right now developing drugs for FSD?
There's probably at least 12 developing all different types of things.
We're all in a race to see who can be first to market.
The top 4 contenders for FDA approval are approaching the start.
My work with Vivus began with a meeting with Kim Ayers. Vivus hired her to curate the erotic footage for the clinical trial videos.
Oh, hi Liz, how are you?
She was a nationally recognized expert on women's taste in pornography.
Well, I think when we're going to select videos that I'm assuming women are going to enjoy watching, I've really found that women do go for plot. They do go for videos that are well shot. People go, porno? Plot? It's really kind of funny. Porno is so subjective. It's like, what gets me off might not get you off.
And I'm a little worried about if it's not the right porn for the majority of women, then this will have an effect on their result.
The only thing we can do is guess. Because that's the whole tough thing about it. If making something as standardized as a testing protocol, you have to assume that most women are going to like what you give them. So that's why I don't want to have Babes, Ball, and Boys or Buttman's European Vacation.
Oh, look, they're wearing condoms. That's good.
So this is definitely...
Oh!
What? That's,
sorry.
I know. See, she's got a little birthmark there. I'll do the sound effect. So I don't know which ones were tape 1 and tape 2.
Isn't it strange the way female sexual dysfunction was only recently discovered?
Right, to medicalize stuff that's been around since history. You know, what is female sexual dysfunction? Is it you're withholding sex because you know your husband's cheating on you? Is it wants and desires that are unfulfilled? I mean, it's so complex.
erotic videos would soon be screening in exam rooms across America. It was time to visit my doctor, Susan Bennett. She teaches a class on human sexuality at Harvard Medical School. I usually visit her when I need a checkup.
Is everything okay with sex?
It's okay.
Today, I was checking up on female sexual dysfunction.
Were there any new medical discoveries that could have prompted this newly named disorder, female sexual dysfunction?
No new medical discoveries regarding women's sexual problems that I know have been reported in the literature. We, as a society, think that we should be able to fix everything by just taking a pill. If women think that they should be having an orgasm every time they have intercourse, a lot of women are going to think there's something wrong with them. If women think that they should be as libidinous at 60 as they were at 25, a lot of women are going to think they need medication to feel better. But if in fact we say this is normal, this is a normal part of aging, you can still enjoy sex, it's not a disease. And you don't need a pill to fix it.
How did female sexual dysfunction come to be seen as a disease? How did that happen?
We don't know.
And how did your company ever start working on a drug for FSD? What's sort of the story about how that came about?
I don't want to go there.
So is there anything organically wrong with these women that you can find, that you can locate, that Alista will address?
Well, that's not, I can't answer that question.
How we ended up developing a drug for FSD. We'll wait for the sun to go away. Saved by the sun. Saved by the sun. I don't know that I could say that. A little bit after the time that Viagra had been launched, one of the local TV stations had come to Vivas and were interviewing people.
In the foreplay process, she will apply a small amount of cream in the vaginal area, topically to the sex organs.
One of the things that Lee said during an interview is we're developing drugs not only for male erectile dysfunction, we also have drugs in development for female sexual dysfunction.
The cream would be available by prescription only to women who are sexually dysfunctional.
We had concepts in development, but somehow that got picked up as we've got drugs for female sexual dysfunction. The market went wild. We didn't even know what the disease was. We just knew that we had something that treated erectile dysfunction and could probably be used in females as well. That's why we're in FSD.
Let me attempt to lay out what I see as one of the freshest, clearest examples of the corporate-sponsored creation of disease, female sexual dysfunction. The key meetings through the mid to late 90s and onwards, the key medical and scientific meetings where this new condition called female sexual dysfunction was being debated and defined and refined, all of them were sponsored by the drug industry.
Who defines whether or not FSD is a disease? Why is it now a disease where maybe it wasn't before? That's a really interesting aspect to what it is that we do. In order for us to develop drugs, we need to better and more clearly define what the disease is. So
We, the drug company, define the disease.
We've been able to get thought leaders involved in female sexual dysfunction and really work closely with them to develop this disease entity.
Why on earth would we want a drug company involved in developing or defining a disease? Clearly they have a vested interest in maximizing the numbers of people they target with their drugs, so they'll define the disease as big and broad and wide as possible.
There's been estimates on the average of 40 million women in the United States alone may be affected by psychological disorders. Sexual disorders, female sexual dysfunction.
If they can transform very common female sexual difficulties into female sexual dysfunction and treat it with a pill, then that's a bonanza for their shareholders.
We, at one point in this company, we had 5 secretaries that had a net worth of well over $1 billion in paper in the stock of the company. But Jane was one of the smart ones. Jane was able to sell her shares for well over $1 million. And so she retired at an age of 34. So those things happen when you're on a roll going up.
Well, it's a very positive year.
Health costs are already exploding in the United States and generally across the Western world. One of the biggest increase in costs is coming from pharmaceuticals. And there is a whole line of argument that says we are medicalizing more and more ordinary life. Certainly in the last 15 to 20 years, drug companies and the thought leaders that they're close to have been involved in some way in defining and redefining and designing conditions. Expanding old ones, creating new ones. Because there's a lot of money to be made telling healthy people they're sick.
One of the reasons the pharmaceutical industry was involved with developing diseases was that in order to create a prescription drug or treatment, the FDA requires that it treats an actual disorder.
12 months of therapy.
So when the FDA said yes,
Yes.
female sexual dysfunction is a legitimate disorder, it started a gold rush as inventors searched for cures.
We're going to call the device the Orgasmatron. Essentially what it's done is that the electrode is threaded up the spinal cord, and then by adjusting the electrical parameters, you will have an orgasm. Leaving it on at a low level, you would have a pleasurable sensation there for as long as you wanted it.
All day, waiting in traffic, shopping, all this was boring towards everyday life.
Yes. The potential market includes the 1/3 of women over the age of 25 in the United States who have problems with orgasmic dysfunction. So I could see having clinics in major metropolitan areas, and other areas overseas would be Amsterdam, Berlin, and Sydney. I hope to make money off this.
And what do you want to call your clinics?
Well, I thought of a very simple sign that says Orgasmatron, inquire within.
This is a symbol of marital happiness. And so we have the 2 ducks kissing each other. There's salt and pepper shakers, and like I said, people give me things and I stick them up there and they know I like this stuff. This is Randall, my husband, and this is me. We're 2 old goats, you see. I am in a loving relationship, and my husband has unconditionally accepted me where I am because he does know this is not about him, this is about me. All of my life, I've had difficulty achieving orgasm.
This box will actually accommodate a total of 8 electrodes.
Charletta and 10 other women were enrolled in a clinical trial of the Orgasmatron.
There are going to be, you have the ability to adjust the sensation no matter what position you're in. So I'm going to turn it up again.
It's taken me a long time to get to the place where I wasn't humiliated so that I could come here and do this and even talk to you like this. But so I'm really excited about it. I feel like I'm well on my way to being healed and being more healthy and normal.
Female sexual dysfunction per se probably runs 83%. Orgasmic dysfunction is a subset of that.
I think that's very interesting, and I think there's a tremendous need then to do this for women, to help women.
I'm not from the South, but I got here as quick as I could. And one of the sayings they have around here is that if Mom ain't happy, nobody's happy.
Right.
Okay. Each time you use the device, and if it does work, we'd like you to fill this out too. Please grade your orgasmic experience. If you need more pages, give me a call and I'll get some to you.
Okay. We have high hopes here, huh?
Yes, ma'am. Yes, we do.
I'm in this to heal myself. Not only am I not normal, I'm diseased. That feels real bad. coming from the religious background I came from, there was a lot of mixed messages about do and don't, and this is wrong and that's right. And, well, the flesh was evil. The flesh was wicked. And so you didn't want to indulge yourself in the flesh or give over to the flesh.
They typically can be accomplished within about 20 minutes time.
And how long does this one take?
About 40. About 40 minutes.
A new article in the British Medical Journal by Ray Moynihan launched a debate about whether female sexual dysfunction was an actual disease.
So what got you writing this story?
A friend of mine sent me a press release that she'd got from a company called Vivus. Alista, New Hope for Sexual Healing for Women. And it's from the Investor Relations Group. Is this about money or medicine? There's this talk here of 43% of women suffering from this dysfunction. And that really, that triggered alarm bells.
It's a secret epidemic that 43% of American women experience some kind of sexual dysfunction.
43% of women suffer from what is now called female sexual dysfunction.
Here's the actual paper that was in the Journal of the American Medical Association that first launched this 43% figure on the world. It's based on a survey from the early 90s. Women were asked a series of questions about common sexual difficulties that they might experience. If they answered yes to any of these problems, they were put into a box that said female sexual dysfunction. And that's how you get to the 43% figure. Ed Lauman, the sociologist from Chicago who did this survey, he himself says that a lot of these 43% of women are perfectly normal. That's his words. And that a lot of their problems arise out of perfectly reasonable responses of the human organism to challenges and stress. A correction appears in a subsequent issue of the journal disclosing that those authors had financial ties to Pfizer. The pharmaceutical industry, through a whole range of very sophisticated PR and marketing strategies, is actually changing how we all think about our bodies, about our health, and about our diseases. Essentially, you're turning healthy people into patients.
How does one effectively protest against the existence of a disease? New York University professor of psychiatry Leonore Tiefer was trying to figure that out fast.
I'm going after the pharmaceutical industry because I just got really upset with the hunt for the pink Viagra, and I thought, well, over my dead body, and I'm going to just do something about this. We know the truth. There isn't a pill for everything. What I'm concerned about is that there is a shift going on in the meaning of sexuality in the culture towards this commodified, individualized thing that has a normal level, and that if you don't experience it in that way, there is something wrong with you, and you need medical help. I just want to say it ain't so simple. It's different for different people. I like the idea that desire is a co-created phenomenon, rather than it being an internal thing. It's kind of like friendship. You don't walk around, how many times in the last month did you have the friendship feeling? Friendship is something that happens between people. And I think sex is something that happens between people.
Leonore Tiefer runs the New View campaign with its hundreds of members from her small apartment in Manhattan.
How is your campaign going to stop the FDA from approving a drug for FSD?
The FDA hearing, the public is going to hear from us, hopefully, as well as from others, that you need to prove that there's a disorder, and you need to prove that your drug is safe, and you need to prove that your drug is effective. And we're going to go down there and try to throw a roadblock in front of their steamroller.
What's wrong with a drug that helps women achieve a better sex life?
It's not just the drug. It's the drug in the context of the advertising, of the lack of education, of the lack of regulation. I think it's a manufactured term to create a market for drugs.
While Leonore used the airwaves to spread her message, medical experts pushed the concept of female sexual dysfunction.
Actually, there are more sexual dysfunctions in women than there are in men.
This is Viagra. This is actually a sample pack, but these, ta-da.
Most of the medical experts had financial ties to the pharmaceutical industry, but did not disclose them.
And Viagra is useful in a smaller subsection of women, but it can improve blood flow and lubrication to women who have that as a problem.
Now there was a movement.
Our proposed indication, as you've heard, is for the treatment of hypoactive sexual desire disorder.
And a counter-movement.
Assessing sexual experience is subtle and complex. Every study must be closely examined for what they leave out.
The two sides were really duking it out.
Look at this.
And it remained to be seen who would define women's sexuality in the 21st century.
Ladies and gentlemen, we'd like to welcome you to Salt Lake City. Local time here is 11:06.
In the midst of the battle, Vivas arranged a luxurious ski trip in Utah for the doctors who ran their clinical trials. There they plan to announce the long-awaited results of the clinical trial of Alista, the same one that featured the erotic videos that I edited.
You know, they come and they relax, they get an opportunity to do some skiing. The one good thing that you do establish at a meeting like this is you establish the relationships. And so once you have the relationships in place, you can play on those.
The words, there just are no words for how good this drug will be once it becomes on the market. The best. These are the people that make it happen. Yay!
I get up at 6:30 every morning and I work until 9 o'clock every night, all for the bettering of female sexual dysfunction. We gotta go. It's time. It's showtime.
At the last minute, a senior executive banned my camera from the meeting. I managed to attend anyway and discovered that Alista was not doing nearly as well as they'd hoped.
It was interesting. What we found in this study was that even when you gave patients placebo, when you showed them visual stimulation, their levels of overall sexual satisfaction in general went up.
So you basically discovered women like porn.
Yeah, so porn works.
Porn works.
It's not, the panacea for solving all your sexual troubles, but it does elicit sexual responses.
Despite the high success rate with the placebo and the plain fact that porn works, Vivas decided to continue their clinical trials of Alista.
You can ask questions of patients that are very simple questions on the surface of things, but small changes in how you ask a question can lead to sometimes very significant changes in the answers that you get to a question.
It's just that improvement is different than enhancement.
And there is a little difference.
We knew that there might be some sort of a small difference. That looks like a big difference. The data never lies.
Back in North Carolina, Dr. Malloy was wrapping up the clinical trial of the Orgasmatron.
I'm waiting for my second visit with Dr. Malloy. It's not working for me very well. And if you want to come closer, I'll demonstrate for you. It's working in this leg, watch. I said I'm not much good unless you like to be kicked in the behind. I had a feeling they were going to take it out today.
Were you able to get close? Not able.
And I tried every position you can imagine on that. I'm disappointed.
In your clinical trial, how many women did the Orgasmatron work on?
We've succeeded in stimulating 8 out of 9, but we've not been able to maintain the electrode in but 6, and of those 6, it's worked in 4. We were able to stimulate 91% of the women, 10 out of 11.
But at this point, I just give up. I mean, it's okay. I accept myself the way I am. There are lots of ways to achieve orgasm other than just to have sexual intercourse. And
Can I just ask you a question? Can you achieve orgasm through other means?
yes, I can. Yes, I can. So I'm not without orgasms. I can have orgasms, but it's just not the normal situation where two people get together and they have sexual intercourse and each has an orgasm. And that's why I say maybe that's not real. Maybe that's just what the movies tell us is real.
Exactly. Most women would not have orgasms from the kind of sex you see in the movies. 70% of us need direct clitoral stimulation in order to climax.
So that's what you were hoping, that this device would allow you to have orgasms during sex?
Yes, during sexual intercourse. And just, again, in what I think is a normal way, but you have absolutely washed that out of my mind. I no longer know what's normal. So that's wonderful, because that's a brand new start.
Charletta was enrolled in a clinical trial for women with FSD, despite the fact that she was healthy.
The heck with that disease stuff.
How many women risk being taken advantage of because of a lack of comprehensive sex education?
What about sex education in America? It seems to me there's an interesting double standard there. Very soon we'll see some sort of orgasm pill or orgasm nasal spray. And we're teaching people abstinence only in our schools.
Did any of you get abstinence-only sex ed training? You did?
Well, it was the woman who was teaching the class. First of all, divided the guys up in one room and the girls in the other, and she was about 80 years old, very, very traditional, and was like, sex is bad, so don't have it until you're married.
What about the bees and the birds? To me, they're just words, honey. What about the bees and the birds? To me, they're just words, honey.
And our health teacher, like every time she told us about another form of contraception or STD prevention, she would just say, well, you don't need to know this because you're not having sex till you're married, and then when you are married, you're not allowed to use birth control anyway. Because if you use contraception while you're married, you'll go to hell.
Do you think that it affected you at all?
Oh, no, not at all.
I was going to college, and my godfather had a talk with me saying, you know, wait until you finish college. After college, then go ahead and have sex. But my same godfather had a conversation with my brother who said, have as much sex as you can possibly in college.
So what would you all say has been your primary source for sex education or information? Peers.
So your peers have shaped you the most and given you the most information?
Yeah.
Women come into Good Vibrations now. Not just young women, older women, women the age of their mothers, women the age of their grandmothers, and they're not sure where their clitoris is. How are those women who can't find the parts of their body that might help them feel the best supposed to function sexually? Is a drug going to help them? Maybe if it has a map of the clitoris on the box. I hope nobody steals my idea.
Mama's got the machine, best sex machine you'd ever see.
I'm Dr. Carol Queen, and I'm the curator of the vibrators.
Oh, Mama's got the machine, the best sex machine you'd ever see.
One of the reasons I love these antique vibrators is because my first vibrator was an antique vibrator, a Stimulax Junior, very much like this one. And I read in a women's magazine in about 1973 about vibrators and thought, isn't that what my parents have in the hall closet? I ran down, I dug it out, then I snuck it back up to my room. I turned it on. It was my very first orgasm. After that, I was not gonna put the thing back. And sorry to say that my parents never asked me for it back. So clearly I was getting a lot more out of it than they ever did.
To the backseat mother, turn about it all day.
The reason we have vibrators today is because over 100 years ago, in the late 19th century, doctors were using vibrators to treat a disease in women called hysteria. When a woman who had hysterical symptoms would go and see her doctor, and her doctor would apply vibration, and she would have a hysterical paroxysm of relief, something that today we would call an orgasm. And by the end of the 19th century, some sources estimated that 3/4 of women suffered from hysteria. Those of them who could afford to do so went to their doctors on a weekly, sometimes more frequent basis, and it was a big business. We no longer call hysteria a disease at all. And what it probably was a combination of stress and women's hard work, plus sexual deprivation and inability to get all the way through a sexual response cycle. In a lot of ways, female sexual dysfunction is the hysteria of this century. It's a new way of putting a lens on women's sexual experience from a distinctly medical perspective.
Women need to feel entitled to their sexual response. They need to go to their doctors and demand to be heard and demand treatment because it is available. And I guess my
Urologist Jennifer Berman and sex therapist Laura Berman were the first to really brand the condition of FSD.
Jennifer Berman are pioneers in the new...
They have become the pseudo-celebrities associated with this particular dysfunction. In 2001, they wrote the first popular book on FSD and used it to launch a huge marketing campaign.
This is a device that was developed to enhance genital blood flow. And what Viagra does is it increases the blood flow to the genital area. You crave sex, you can't stand sex.
Within a very short time, they had their own TV shows, a call-in radio program,
want to have
a
sex.
syndicated newspaper column, and sex clinics.
From the Berman Center in downtown Chicago, it's time to talk about your love life. The Dr. Laura Berman Show. No men allowed. This is all about women.
Hi, welcome to the Berman Center. My name's Naya and I'm the patient concierge. I just wanted to introduce myself. If you want to follow me, you'll meet with the sex therapist. The sex therapist will be looking to determine if there's any emotional or relationship issues that may be contributing to the patient's problem for coming in today.
Do you want me to talk to you or talk to the camera? The Berman Center is really sort of a culmination of my professional dreams over the past 10 to 15 years I've been working in this field. Well, my husband, he's the one who raised the money to open the center, but also he wears a business hat in a way that I, as a clinician, don't. So it's really a nice marriage, literally and professionally.
If vibrators were recommended, if lubricants were recommended, it would be at the patient concierge point that we would go through them and talk about them and answer any questions that they had.
So you were really involved at the beginning, weren't you, of this? How did it all happen? Yeah, from the beginning, when all of the focus started on female sexual dysfunction, the medical piece of it, there have been a lot of companies that have been trying to develop drugs or medications or medical devices for sexual dysfunction, and I've been involved with just about all of them. I was one of the principal investigators of Viagra in women.
At the halfway mark, Viagra, the favorite, is bringing up the rear. trouble on the track. Viagra is not working any better in clinical trials than sugar pills. So Pfizer yanks her from the competition.
So would you recommend that doctors continue to prescribe Viagra for women?
I still feel really strongly that Viagra and drugs like it, the vasodilators in general, which improve blood flow to the genital area, definitely have a role as part of a comprehensive treatment plan for women. The initial...
Laura Berman is playing a dangerous game here. She's promoting the use of Viagra, even after Pfizer has found it does not work in women, and the health risks are unknown. Once a drug has been FDA approved for a particular condition, doctors can legally prescribe it for any disease. It's called off-label use. That said, it's illegal for pharmaceutical companies to promote off-label use of their drugs.
So would you recommend that doctors continue to prescribe Viagra for women off-label?
I do recommend it for women who have arousal problems, loss of sensation.
Here is a senior figure, Dr. Berman, suggesting that doctors prescribe Viagra off-label. And yet Pfizer has called off the trials for Viagra in women. They can't show that Viagra has a meaningful benefit over sugar pills. It's a very subtle way to get around the approval process. The Berman sisters are key characters in the development of female sexual dysfunction. The trouble is that with such influential figures, they are so close to the pharmaceutical industry, on occasions working directly with drug companies, paid by drug companies.
And our topic is Viagra. It does a bing for men, it does sort of the same thing for women.
Our patient takes Viagra. Viagra. I have no vested interest in Viagra. Our goal is to, whatever drug, whatever hormone, is to help women. But
does Viagra work?
Viagra works. Now you'll be going to the sensory testing room where the physician will monitor blood flow to the genitals. If you'd like to go ahead and have a seat, she'll be with you shortly.
This piece of equipment is going to test your nerve function at your clitoris and right inside the vaginal opening to warmth, coolness, and vibration. And how that's done is I'm going to give you this button. Here's the first probe that we're going to use, and the metal tip on this is going to be placed against your clitoris.
So would you hand that to me, or would you hold it?
No, at
There you go.
$50,000, I don't want anyone to drop it. It'd be an awfully expensive visit. Okay. Then you're going to depress your button to indicate to me that you have felt something. Okay?
Are there articles that I could read about the tests that you run in terms of what the norms are?
Medoc, the name of the manufacturer for this piece of equipment, Medoc has the information that determines the normal ranges that we look for in these patients. You'll wear these 3D glasses. You'll be watching an erotic video. And the whole idea, again, is to get yourself excited, bring some blood flow to your genital area.
Your total today is $1,500. We take cash, check, or charge.
Television in the United States wasn't always full of doctors and ads pushing pharmaceuticals and diseases.
If you just say no to drugs, you'll be saying yes to a whole lot more.
While Nancy Reagan was telling us to just say no to drugs, her husband was signing a bill that would make us the pill-popping nation that we are today. President Ronald Reagan opened the floodgates for direct-to-consumer advertising of pharmaceuticals. In 1997, thanks to further deregulation, the pharmaceutical industry started advertising like crazy on TV.
This is the age of Fosamax.
Oh no!
I live deep under your nails. They aren't kidding.
And I've been on it for years.
And you gotta love that!
Even our pop culture heroes are dependent on prescription drugs.
Well, son, your Uncle Homer is like 80% of America, whacked out on prescription drugs.
But users are losers.
You're confusing drugs with drugs.
For now, the United States and New Zealand are the only countries in the world that allow direct-to-consumer advertising of pharmaceuticals. But the drug industry is putting pressure on other nations to change their laws.
What we do is we prescribe. That's what we do as a profession. We're not paid for counseling. We're paid for action. Writing prescriptions, seeing a certain volume of people per unit time. I think doctors want a pill too. Doctors want to be able to write a prescription for something that's going to help a woman feel better about her sex life. It's the easiest part of what we do. And it's kind of what patients have come to expect.
Deep into the race, the key players are quickening their stride. But wait, from out of nowhere, over on the sidelines, comes what could be a real game changer.
Sex surgery.
Some of the new inventions to treat FSD were starting to hit the marketplace. At a trade show for doctors, medical companies were marketing new extreme treatments.
It's a bloodless surgery. I'm here to speak to physicians that are interested in incorporating a new procedure into their practice. It's a procedure that gives women additional choices for regaining sexual gratification that they maybe have lost as they've aged or had children. You use the laser to make an incision. You're able to push the bladder back up to where normally in a young person it would be, and then bring the muscles back together, making it tighter.
Do you think there's a chance that some of the nerves of the clitoris could get cut?
Well, with any surgery, there are going to be risks. We also train them to do something that's called designer laser vaginoplasty. A lot of women feel like they're unhappy that their labia are abnormally long, and it really is, in a sense, plastic surgery.
What is an abnormally long labia?
I think that that's up to the woman to decide, and so again, this is all about giving women choices.
I'm feeling uncomfortable about this.
I am. I'm hating this part of it.
You are?
Yes.
Why?
See, now I might have to ask for the tape back.
Yeah, you don't want to talk about this?
No, just because this part of it I am ambivalent about.
The plastic surgery part.
I think that our culture has made women feel very self-conscious and uncomfortable with who they really are. And so there's always this attitude of feeling like I need to be perfect. And really, I think people should be happy with who they are.
These magazines have published articles promoting cosmetic genital surgery.
One of the things that really motivates gynecologists to start offering these procedures are that as they went into gynecology to deliver babies, to help women, all of those good things, but after a while they find that they're tired of being on call, tired of running out delivering babies in the middle of the night, and it just gives the surgeon or the gynecologist a better quality of life for himself or herself.
I asked Lisa to show me before and after photos of women who had undergone the surgery.
Be more comfortable if you wouldn't film the pictures. So this is actually the presentation as part of the training course.
Oh.
So you asked for it.
Oh.
Okay.
I think I'm going to be faint. They want to look like little girls. This is all making them look just like little girls.
I hadn't thought of it in those terms, but you're right.
That's really disturbing.
So, yes, at least give me enough time to find a new job before you air this.
Okay, you're going to go job hunting now?
I am. I'm going to go home and go job hunting. So I don't have to feel conflicted anymore.
I don't blame you.
procedures that I had done were a labial reduction and I don't know how to phrase it. I guess it would be a clitoral hood reduction as well. I did think that this would help me achieve orgasm with sex. And my gynecologist did have hopes that it would help. The surgery itself went well. When I got home, I actually got a mirror to look at the surgical site, and there was a huge gush and a huge splurt of blood. And then at that point, I knew a suture had popped. By the time I got to the emergency room, it was dripping down my leg onto the emergency room floor. They had to do emergency surgery. The tissue in the genital area is very vascular. If it does bleed, it's going to bleed a lot and fast. My doctor said that I lost about a third of my blood volume. And had I not sought emergency treatment as quickly as I did, it could have gotten a lot worse, and yes, there was a possibility of me dying. I was hoping that after this procedure, I would be able to achieve orgasm with just intercourse, but that did not happen.
Due to intense marketing, 8 cosmetic genital surgery clinics opened up in New York City.
Teenagers are having this done. And there's a sense that the labia minora needs to be sort of symmetric and tidy. And labia minora are a very important part of erotic genital tissue. Everybody's different. Some people have very small labia, some people have asymmetric labia, some women have very long labia. It's all normal. Any kind of cosmetic surgery to the external genitalia is a form of genital mutilation. I can't think of any rational reason for it. One of the main reasons not to do it is that women can end up with chronic pain syndromes. And we shouldn't be allowing it. And we are, in fact, allowing it.
It's 8 years into the race, and it shows. Uh-oh, Vivas can't get Alysta to work any better than a placebo. So that cream is out of the race.
With Alysta and Viagra dropping out of the race, it was becoming clear that the drugs that have been made to give men erections were not working on women. It seems that it takes more than increased vaginal blood flow to give women orgasms.
Hi Craig, this is Liz Canner calling. I'm calling just to check in with you about the filming that we discussed. Still trying to reach you because I wanted to check in with you about filming. Still trying to reach you.
Perhaps because they were failing, Vivas did not want to be interviewed anymore about Alysta. The creams, pills, and vaginal surgeries and the Orgasmatron were not providing the quick fix that the industry had been hoping for. Maybe this is because most of women's sexual problems are not purely physiological.
I was working full-time and taking care of the kids and taking care of the house, taking care of everything. I was physically tired, and I was mentally tired, and I was emotionally tired. The last thing that I wanted at night or any time was for someone to touch me in a sexual manner, because it was just, I felt like all day long I had been pulled out and touched and had little hands on me, you know, taking care of kids all day and then still trying to work. And sex was just not important.
I was abused sexually as a child by a relative of mine. I do realize that men of my culture specifically, that I have a much more fearful reaction towards physically. I've had experiences where I've felt like my whole body sort of closing off to a certain type of person, and I'm sure that has to do with the past.
My first few years of sexual experience were not that enjoyable. It was as though I felt the urge to, but I couldn't let go into enjoying it. I had an idea of what sexy was, and I wasn't it. Can't even really lose myself in the moment, because you'll be like, oh, well, I have to, don't look at me from that angle kind of thing. Not in the middle of the day when all the lights are on.
I mean, I'm not in that relationship. I'm in another relationship. But I still have kids, and I still work full time, and I still have life, and it's still busy, and it's still crazy, and it's still hectic, but it's different. And now the workload around the house has been lessened because there's more equal sharing. I'm not as exhausted as I once was. So intimate and emotional needs are being met, and so I do feel like a sexual being, and I do want sex, and I do desire it.
My partner right now, who's like one of the most caring, sensitive people in the world, is of the same culture as me. And when we initially started seeing each other, I was very, 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 very afraid. Memories don't go anywhere. They just physically stay with you. Like, I see a therapist. I think it's something that's really, really important to realize that most sexual health problems are all a lot related to things that therapists or psychiatrists need to talk to you about.
So I definitely feel that things have changed, but I mean, I'm getting there. I wouldn't say that I'm like, I've reached, full sexual liberation. But I really learned how to love myself and give myself what I needed. And to be able to make myself feel beautiful and sexy. Or not even make myself feel that way, but just allow myself to feel that way. Then maybe I feel that way naturally if I'm not trying to judge it or confine it. Okay, I'm gonna leave now. Attractiveness actually is like a feeling that comes from within, not how good your thighs look in fluorescent lighting. Dude.
The whole thing with taking drugs for this or for that, my belief is living for a drug-free America. I mean, don't take drugs.
Sex expert Kim Ayers invited me to meet up with her at a pharmaceutical-sponsored conference on FSD for doctors. Kim was planning to train doctors in her non-medical, pleasure-based approach to helping women with sexual problems. But the organizers would not allow Kim to speak. So she crashed the conference and booked her own room in the same hotel.
I'm completely thrilled by the turnout, and I am so honored to be able to do this today. I don't have a clinical background. I have a pretty active sex life and always have, and I combine two of my favorite loves with my career, which is sex and retail. I tend to use things to teach women about their own anatomy. And fortunately, there's some great tools out there. This is one you may or may not have seen. It's called the Wondrous Vulva Puppet. Now, it's pretty accurate, as I like to point out, except for the fact that it's satin and velvet. So something like this is just really unobtrusive, not scary, and kind of nice and comfy. I've done a lot of workshops that women have like held this and they've actually cried because it's so intimate to them. Now, getting into the realm of sex toys. There's quite a few out there, but these pertaining more to FSD symptoms. This is the coolest thing out there, all right? Pretty simple. Now, when you squeeze this, you squeeze it with Kegels. And it'll make the, isn't this something? You get the whites going, bingo. I tried this with a pal, And it was so much fun. He's like, go on, get more lights. I'm like, oh, you know, and stuff. So, yeah.
I think this was absolutely priceless. It was wonderful. And especially when we have been exposed to so much scientific data, this is the kind of meat and potatoes stuff we need. And maybe I shouldn't have said meat and potatoes, but I would hope that each year she can continue to do it. And I don't know, maybe we can even begin to integrate it into the program, because this is incredibly important stuff. So I really want to thank Kim for all of it.
Just when the world of sexual medicine seemed like it was improving, Procter & Gamble announced that they had a drug that worked.
Intrinza shoots out in front. She's picking up the pace. Wow, look at her go. It looks like she will be the first FSD drug to win FDA approval and claim the $1 billion prize.
A new female sex patch called Intrinza is on the fast track to FDA approval. It is said to significantly boost sexual desire in women.
There's an update in the news now about the search for a treatment for sexual dysfunction in women. Low doses of testosterone delivered through a skin patch.
Let's just say the next thing we're doing in this campaign is that the FDA is going to evaluate the testosterone patch. Now, I don't know if the FDA is expecting, well, never mind the FDA, I don't know if the P&G is expecting a lot of opposition. They are expecting me. And I'll do the best I can. But it would be nice to have some other people. And whatever happens, sex is acquiring a different meaning. We have to be prepared. Thank you.
Vivus was a pretty small company, but Procter & Gamble sure wasn't. Leonore and the New View campaign were up against one of the biggest companies in the world. Procter & Gamble was so confident that their drug was going to be approved that they began a $100 million marketing campaign for Intrinza months before the FDA hearing.
Women getting the hormone, not a fake patch, said they had 4 times more sex than usual and were happier.
These are highly statistically significant results. Most women who have low libido or even other kinds of sexual function complaints may have low testosterone and don't realize it.
Procter & Gamble and a lot of these other companies are banking on a simplistic notion that sexual desire is just testosterone. It's just hormonal.
Most of the news stories on the patch failed to mention some of the likely causes of a diminishing libido.
Why did P&G decide that they wanted to start looking at testosterone?
P&G has been very committed to women's health, and we have tried to take care of the full woman. When they first became interested in the testosterone patch, they felt that this would add to the whole gamut of taking care of the whole woman.
So when you did your clinical trials, who did you test the testosterone on?
The clinical trials were in women who've had surgery and had their ovaries removed.
Were they also taking estrogen?
Yes. In fact, in all the trials we've done so far, surgical and natural, all the women have been on estrogen.
So it's not going to necessarily be the miracle drug for everybody.
Personally, I believe it's going to help most because it does improve desire, it does improve arousal, it does improve orgasm. Right now in clinical practice, there really is no normal for testosterone levels. And when you actually ask somebody, well, if the level's high, what will you do? If the level's low, what will you do? And physicians really can't say what is normal.
In order to learn more about testosterone, I met up with behavioral neuroendocrinologist Kim Wallen of Emory University.
From a very early age, I had this sense that sex was something that was extremely powerful, and I also had the sense that we didn't know very much about it. So when I discovered in college that you could actually study sex, that was really, I think, what I was most interested in and most committed to.
He has devoted his life to studying the effects of hormones on sexuality.
It just turned out that I ended up working with monkeys, and I think they're actually an ideal system. It's clear that hormones are probably not even the biggest factor that influences sexual motivation. Context is much more important. If I see a young couple on their honeymoon in the Caribbean, I actually don't need to know what the woman's hormone level is or what the man's hormone level is to know that they're likely to engage in sex. And it really has nothing to do with hormones in that situation at all, because the social context of their relationship and the context of where they are in a relaxed atmosphere may be actually much more important in influencing sexual behavior.
So why is this testosterone patch thought to work?
I think there are a couple of reasons why testosterone is being pursued so actively by drug companies. I think there's this just a very strong notion that testosterone is a hormone that affects sex drive. We certainly know that that's the case in men. I think it's easy for people to sort of feel, well, it must do the same thing in women. It must affect sex drive also. But we really still don't know exactly how these hormones interact with each other to affect female sexual desire.
So what are they doing there?
So she's saying, these are my genitals. Don't they look good? She's going to actually start trying to turn this guy on.
So what do you think you've learned over all these years about sex?
To pay more attention to females. That was my first great insight, was that females were actually telling males a lot that males weren't paying any attention to.
You know, we need to talk a little bit about, but I'm not sure what we're going to do about it, is this FDA meeting on December 2nd. You know, I've started collecting the original research on these tests. These women are not being tested for a testosterone patch. These women are being tested for estrogen plus a testosterone patch, and nobody's talking about that. And it is my belief that they tried without estrogen and the patch didn't work. It's, of course, the question is, what have they not included? The success will not be measured by stopping this drug, because there are Androsorb and Alista and Estrace and Estratest and Avista and Femprox and Intrinza and Livial and NM1870 and sterile noriesocene and testosterone creams and Tostrel, a gel, and Vasofem.
And do you think that there's a chance that you could have an effect?
Well, I always think there's a chance we can have an effect.
I'd like to first remind the audience and committee members to please put your cell phones on silent or vibrate.
The FDA hearing was set up like a debate. Procter & Gamble presented their data. Then the FDA reanalyzed that same data. The public had a chance to weigh in as well. The judges were a panel of expert doctors. Finally, at the end of a 10-hour day, the panel voted on whether to recommend Intrinza for approval.
This new drug will be requested by many people on whom it has not been tested. Believing that it's safe, these women may well become the guinea pigs of the 21st century.
I would urge the committee to not approve this, because I think it is a premature drug that simply does not solve what is a very important and critical problem, but this is not the answer.
The next presenter is Leonore Teifer.
My name is Leonore Teifer, no money, no way. As a psychologist with over 30 years of teaching, research, awards, and publications in sexuality, I see today as a perilous moment in the history of women's sexuality. Intrinza is not a glass of Chardonnay, and yet we have already seen that it may well be promoted with a giggle and a wink as the female Viagra. Not so. This is a steroid hormone women must continuously take for weeks before getting an effect.
Patients treated with testosterone also experienced significant increases in numbers of sexual episodes and in numbers of orgasms.
The key issue for us, there was a strong placebo effect that persisted throughout the trials. And the difference of placebo compared to testosterone treatment is not clear to the division.
But it looks to me like about 36% of the placebo patients would really like to continue the therapy. And about 50% of the treated patients would really like to continue the therapy. And I want the sponsor to consider marketing the placebo.
The testosterone transdermal patch is both safe and efficacious. There do not appear to be any major hormone safety issues with Intrinsa.
Testosterone was very strongly actually related to breast cancer risk. 2.2-fold increased risk of developing breast cancer. This was highly significant.
In addition to being concerned about the side effects of testosterone, the FDA was also alarmed by the health risks associated with the long-term use of estrogen, as found in the WHI study.
In reality, there was a 24% increase in the risk of coronary heart disease. There was a 31% increased risk in stroke. Venous thromboembolism was doubled. There was an increase in breast cancer. There was a doubling in the rate of dementia if one was assigned to active hormones.
Just because it was the WHI studies were disappointing. We're not debating the safety of estrogen here. It's only the
I'm
patch.
not so sure if we are or are not.
I don't understand this. I mean, if they're mandating these patients have to go on long-term estrogen and then use the patch, then basically, aren't you back to where you were with the discussion of the safety of estrogen? You're putting a product on top of a base that already has warnings.
The risk that was seen with Vioxx was very modest. But when you translated that to 105 million prescriptions and 20 million Americans, it represented an enormous burden. The potential for this agent to increase the risk of cardiovascular morbidity and mortality is substantial. I also don't want to expose several million American women to the risk of heart attack and stroke with their devastating consequences in order to have one more sexual experience per month increased.
So we now reach our fourth and final question, and that is, are the efficacy and safety data adequate to support approval of TTS?
No.
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 No. No.
No.
No.
No.
No.
No.
No.
No.
No.
No. I want to thank the committee for their hard work and also our participants in the open public forum. And this now concludes our advisory committee meeting. Thank you.
What's the need for a product like this, even though this one didn't measure up?
See, I don't feel that there's a disease. That is a point that I'm not sure is widely shared. One episode a month makes people happy. Then I can help people get one episode a month. I mean, it's a homework assignment when you come to see me.
Up next. On a testosterone patch designed to help women. Its maker, Procter & Gamble. It could be a huge moneymaker for them, but an FDA advisory panel today had some other ideas.
This is not a drug like Viagra, where you take the pill and 24 hours later it's out of your system.
Sex is a very important part of our lives, and to do without it is something that we think we can resolve through pharmaceutical agents today.
Amazing. What a comeback. After failing to receive FDA approval in the United States, Intrinsa wins authorization in the European Union for use in women who have had radical hysterectomies and are taking replacement estrogen.
Sex sells, and so it's where you follow the money.
Follow the money. Yeah. Down there.
Yeah.
This drug will probably fail because it's not effective enough and not safe enough to be unleashed on the world.
I'm normal.
Right. That word.
I'm not diseased. I'm just normal, honey.
Sex pill, I need those hormones, baby. Sex pill, sex pill, I need those poisons, baby. Sex pill, calling doctor of pleasure, doctor desire, fill my prescription and light my fire. Sex pill, I need those hormones, baby. Sex pill, sex pill, I need those hormones, baby. Sex poisons, baby. Sex pill, sex pill.
There's the end of my wire.
It's pretty straightforward. Lock it down like that.
Mm-hmm.
And as we turn it clockwise, it starts to deliver
Stimulation.
Mhm.
Woo! Oh, that's too strong. This is in the leg right now. Turn that off. Woo!
Is that better?
Yeah.
Okay.
How did you discover this in the first place? What happened?
Well, it was a complete case of serendipity. I use these device spinal cord stimulators to treat people with intractable pain. One day I was in the operating room placing one of these, and I put it where I thought it would help the patient's leg, and we turned it on, and she let out an exclamation. I looked around the drapes and asked the patient, "Where did you feel that?" And when she caught her breath, she said, "You're going to have to teach my husband how to do that." And that brought the entire procedure to a complete halt because I had no idea what to make of that. A day later, I was having dinner with a friend of mine who's a gynecologist, and he said that about a third of his patients have that as their chief complaint, and that I ought to pursue it. And so I went ahead and sought out a patent and was granted that, and now we're in our clinical trials. I live here in Winston-Salem, and this is a very conservative community, and I really didn't know how the public was going to react locally. I mean, as we've said, everybody's interested in sex, but nobody wants to talk about it. I guess the consensus has been that a lot of local women have been interested one way or the other. That's been communicated to me, and The men feel that they'll have more time for fishing.
Any problems with sex?
I'm seeing this person now. I'm just thinking in terms of the long term. I hear of so many people losing their libido down the road. I just get worried about that if you're with the same person for 30 years.
You know what? This woman did this great study, and she found that the vast majority of women who've been involved in a monogamous relationship for a decade, whether they're married or living with somebody, are completely sexually satisfied and have virtually no libido, in the sense that their fantasy and their basic drive to have intercourse doesn't really exist the way it does in the beginning of a relationship when there's a lot of excitement and anticipation, but that the women are perfectly sexually satisfied. It's key to be willing to engage and to have faith that it will be okay, even if it, it's kind of like sitting down and eating an ice cream sundae when you're not hungry. You can appreciate what an ice cream sundae tastes like, and you can, imagine what it would feel like to be really hungry, but you're not hungry. You have to make a leap of faith that if you sit down and have a bite, that you can maybe eat enough of the ice cream sundae to be satisfied, like that. One of the things we teach is, for example, like the clitoris. This is the other big surprise. The clitoris is not, as it's described in one of the major anatomy textbooks, 7 centimeters, which is like this. 7 centimeters is maybe like this. Let me show you a picture of the clitoris. This is the clitoral head. It's very small. And this is a part of the clitoris that everybody's aware of. And in fact, it's probably the part of the clitoris that people think is the only clitoris. And it's actually the glans, which is the equivalent of the glans penis, the very tip of a man's penis. Now we're going to pass in to the inside of the body as if we had X-ray vision. And these are the bulbs of the clitoris, which are actually very large structures that surround the urethra. It goes almost 2/3 of the full length of the urethra from the outside of the body in toward the bladder. This is the glans. This is a part that we're aware of. And then it goes back, fused, and then separates. And there are these large parts of the clitoris that actually attach deep into the pelvis, so that the whole structure is about 5 inches long and much bigger than anybody thinks, including the anatomy textbooks. The most intense area of erotic stimulation for arousal is just above the clitoris. It's like a fan above the clitoris. And then inside the vagina, they found that the cervix was the most sensitive. The vagina itself was actually not particularly sensitive to sexual stimulation, which would not be a surprise for most women. Questions?